Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hey everyone! Today we're going to talk about childhood constipation. I feel like I find as I talk to more moms, tends to be a little bit more of a common thing. It was something we dealt with my son when he was right around a year old, maybe a little less. So I'm very interested to learn and hear what Dr. Jordi Smith has to say.
Thank you for having me on. I'm super excited to talk about this. It's one of my favorite things to talk about, honestly. So I am Dr. Jordi Smith. I am a naturopathic doctor with a focus in pediatrics. I end up seeing a lot of kids with eczema, constipation, allergies, and then child exams. So I do everything that you're typically used to in a pediatrician's office, right? We do milestone checks, weight checks, we do full physical exam. I just also like to add on the preventative aspect of things. So we'll talk about gut health. We'll talk about food introduction, sleep, diet, lifestyle, all of that kind of stuff to ultimately make it so they hopefully don't have to go to the doctor when they're an adult, right? They can be nice and healthy.
Yes, the goals, right? Preventative health instead of fixing something that's wrong. Before we get into all of the details, let's start off with just the basics. Can you share a little bit about what constipation is?
Yes. So most of us are familiar with constipation, and it's something that all of us will likely experience from time to time. So constipation in its simplest state is not evacuating all of the stool in your body. So we typically think, oh, I've gone a couple days without having a bowel movement. That's constipation. Now, constipation also can be, I'm straining to have a bowel movement, or you see your toddler has little pellets of stool, or even the stool that might be one long piece, but you actually see the little cracks in it, almost like they're little pellets stuck together. So there's lots of different things that constipation can be, whether it be skipping days, hard stools, straining, but ultimately we're just not getting everything out that we should be.
I should have probably let everyone know that we would be talking a lot about poop. Luckily, we're moms, so we probably already talk about poop.
My husband always introduces me as a poop doctor.
So what does constipation look like in, say, infants and toddlers?
Yes, so it does look fairly different depending on the age. Starting with infants, you may have seen breastfed infants will have a bowel movement maybe 7 times in a day. And technically, it can be normal for them to go a week without a bowel movement. Now, I personally don't like seeing them go a whole week without a bowel movement. With the idea behind that is breast milk is highly absorbable, right? When you're newborn, you're absorbing a lot of that breast milk, you're not pooping it out. But if your child is straining or you can tell they're uncomfortable, to me, that lends more towards constipation. Now, after food introduction, then we start to have more regular, solid bowel movements. But what can happen is because of our digestive capacity at the start of solids, we get more constipated. So that would look like skipping a day. If a baby is consuming solid foods, I want to see them going to the bathroom every day. When we get more into toddlers and children, again, it's at least one bowel movement a day. It technically can be normal to skip a day here and there, but generally one bowel movement a day. And like I was talking about, even the straining or the hard pellety stools, that is also considered constipation in kids.
So why does constipation occur in infants and toddlers?
So that's actually a big question. So it really depends on the kid, the age, what's causing it. So some things across all ages that can contribute are one, food sensitivities. Maybe a child is sensitive to dairy. Dairy is the most common one when it comes to constipation. Now that can happen in breastfed infants too, exclusively breastfed. If mom is eating dairy, baby is sensitive to dairy, we can actually see constipation in baby and mucus in the stool, blood, things like that as well. And when we start having solids, when we're a little bit older, we can also see food sensitivities outside of dairy, right? So we can see things like gluten or eggs, lots of different things that can contribute to constipation there. Now, another one that can run the gamut as far as all the ages is an alteration in the gut microbiome. This is a really important one to me because the microbiome is so important for future health. Having a really good microbiome can protect us against autoimmune disease, cardiovascular disease, mental health disorders, various other things. And so if I see constipation and we can't exactly pinpoint what it is, it might be that we don't have enough good bacteria or we have too many bacteria that we actually don't want in there, something called dysbiosis. So this is pretty common in kids who are born by C-section, are not breastfed, or have used antibiotics for whatever reason. So that's some of the causes across all the ages. Some things in kids that are consuming foods that can contribute is dehydration. Super common. It can be really hard to convince kids to drink water. Kids just not having enough water. We don't have enough water to actually hydrate the stool to get it out. Additionally, not enough fiber. Fiber is found in things like fruits and vegetables, beans and legumes, and those having not enough of those can make it so we don't have enough fecal bulk. There are so many other things, whether it be mold exposure, celiac disease, hypothyroidism, but the ones that I mentioned are probably the top ones that I see most commonly.
What can parents do to help support their kids with this if they are going through it?
Great question. So it's going to be a mix of the palliative, right? So let's get our kids going and what's actually causing it at its root, right? So any patient that works with me knows that if they come in for constipation, I'm not just going to send them away with, oh, take this supplement or do this thing to make it so they don't have constipation, right? We'll do that for a little bit, but ultimately we want to see what's actually causing it. So the palliative side, right? Things that can generally help for the little ones. I love castor oil abdominal massages, bicycle kicks with the legs of infants. I also love introducing pea fruits. So peaches, prunes, pears really helps to get things moving. As they get older, we can do extra fiber in the diet or even a fiber supplement, introducing Korean probiotics. And in even older kids, we can also do things like magnesium, specifically magnesium citrate and vitamin C. Now, those are the palliative things, right? But we also want to make sure we're addressing what's causing it, right? So maybe your kid is not drinking enough water. Okay, the treatment there is drinking some more water. Same with fibrous foods, right? Maybe they are sensitive. We think they might be sensitive to dairy. Let's do a trial elimination diet of 3 weeks without dairy, see how they do. With the microbiome, it's a little bit more specific. We can try and see if they do well with pre and probiotics, or that's one of those scenarios where you might want to get their stool tested by a provider.
So I feel like you mentioned a lot of things that we ended up doing. We did the prunes in smoothies. We did vegan yogurt that had a probiotic in it and a few other things that the oh gosh, gastroenterologist recommended. And our situation was very different. It was just more of a bad rash that ended up turning into a constipation issue because he didn't want to go. It hurt his poor
Oh.
little bum. I know you feel so guilty, but it was all good other than that.
Introducing the Secret Mom Hacks podcast. Hosted by me, Krista Dykes, this show is for first-time moms who wish to model the best version of themselves for the tiny humans looking up to us. From self-care and worthiness to navigating unique parenting obstacles, expect new weekly episodes that are honest and relatable no matter how old your child is. Subscribe to Secret Mom Hacks wherever you listen to podcasts and leave every episode feeling inspired and hopeful, knowing you are not on this mom journey alone.
Oh, and that is another scenario I should mention is especially in toddlers, especially around if we do have a diaper rash or if we're potty training, sometimes we just have stool withholding. And so we clench those cheeks. We do not want to go. We're afraid of it falling into the water and making a sound, whatever it might be. So we do see that as a cause as well.
So, given all of this, when should parents be concerned about their little one's constipation if they're seeing that it is occurring, or maybe there hasn't been a few days where there's a stool, or say like the rash? Like for us, it was a matter of a couple of weeks with pretty bad. Anytime he had to go, he was crying, and we're like, this is just
Oh,
not normal. So for us, that was like the okay, like we're trying whatever we can at home, holistic remedies. So we obviously need additional help if we're not fixing it.
totally. So in the scenario where they have a rash around the anus and won't go away, it hurts to go, we get constipated from that. Sometimes I'll actually do a little bit more investigating into the microbiome and see if there's a candida overgrowth. Because oftentimes an excess of yeast can actually cause those rashes, cause them to get worse. And so if we have that, it can also contribute to constipation. So that's an example from that scenario. As far as when parents should get concerned. Now, constipation is extremely common, even in adults, right? If we have a day where we eat processed foods, we don't drink enough water, we don't have enough fiber, we might get constipated. So if it happens every now and then, we're less likely to be concerned. If you're able to pinpoint something specifically that they're eating or not drinking enough water, and you can easily pinpoint that and change it, we're not concerned, right? When I get concerned is if it's something that is ongoing, or if it's in combination with things like allergies, things like eczema, then we really want to see what the root cause of that is because it can contribute to other things. The way we are able to evacuate our stool in kids is how we detox. So we're constantly exposed to this chemical soup of life, right? There's lots of different things, and you can't avoid that. But if you're pooping, then you're usually able to process things. So that's why I tend less concerned, but more, hey, I'm curious what might be causing my kids' constipation. How do we get them going more frequently? In any kid where it lasts, right? It's not just this intermittent thing that kind of happens every now and then. Additionally, if they have constipation in combination with the things that I was mentioning, so C-section born, not breastfed, antibiotic use, that's when I am a little bit more concerned because I want to see if there's an alteration in the microbiome causing it. And we want to nip that in the bud as a kid because it's not hard to change as a kid. And if we don't change it, sometimes we can see health effects later on, whether it be in the skin, in the immune system, various things like that.
So if parents get to this point of, okay, whatever I've done at home is not working, this has been going on for a couple of weeks, holistic remedies are just not doing the trick. What, once they reach this stage, what should they do?
So I would reach out to a naturopathic doctor that specializes in pediatrics. So obviously I'm biased because that is someone like me. You can try starting with the pediatrician. Most families that I work with tend to just leave the pediatrician's office with Miralax, which I'm not a huge fan of because it's not meant to be used for more than 7 days. And it also is something that is a band-aid, right? Like I was saying, what's the root cause of it? Now, as a naturopathic doctor, we have a lot of tools in our toolbox. I get to do stool testing. I get to do food sensitivity testing. I get to use some different things. And so that's why I say go to a naturopathic pediatrician. We're able to really be able to delineate what is normal and what might have a different root cause, be able to nip that root cause in the bud so that we don't have future diseases. Because constipation is just a sign that things are not going properly, right? It might not be something that's extremely severe. Sometimes we have kids with full bowel obstruction. If they really have not been going for a while, they have huge bloated belly, then we might want to go in and get an x-ray done, see if we have any impaction there. But ultimately, kids will get constipated. If it happens more frequently, go get investigated by a naturopathic doctor.
And then obviously a lot of that is going to be based off of their insurance and if they need to get a referral before. Yeah, if you are one of those that need to get a referral, make sure that you check with your insurance, check with your doctor before reaching out, I would assume, right?
Yeah, so it depends on the state. In California, naturopathic doctors are not recognized by insurance companies, so they will be out of pocket. In a lot of other states, Arizona, there's a lot of other states that you can just see a naturopathic doctor as your conventional primary care pediatrician. as well. So it depends on
Okay.
what state you're in. But in California, they're a little picky. So in that scenario, just reach out. It's going to be cash pay. But fortunately, again, the goal is not that you have to see us forever. It's that we can nip things in the bud so that they don't have to go to the doctor as frequently as an adult.
Yes. Hopefully you don't have to be in there very often.
Hmm.
Finally, last one. Do you have any tips, suggestions, or recommendations for anyone that is possibly struggling with constipation with their little ones?
Yes. So keep calm, right? So it's very common. Constipation is very common. If my goal really for you is to be able to delineate what is abnormal with versus what is normal, just get curious. Did they eat processed foods yesterday? That can contribute to constipation. Did they not have enough fiber? Did they not drink enough water? Think about the things that could potentially be causing the constipation before running to, oh, they're diagnosed with constipation, right? Are they just a little bit backed up? Do we see specific foods that trigger it? Really, it's about the curiosity about your kid's health and using it as a sign, right? It's a sign of what's going on internally. If they're backed up for a very long time, that's where we go and do a little bit more investigation. And now, from my perspective, kids are so fresh, right? They are so malleable. We're able to really set them up for optimal health in the future just by looking at symptoms and getting curious as parents. So anytime something pops up, just get curious, maybe bring it to your naturopathic doctor and say, hey, do you think this is something not, what might it be? And feel comfortable just talking to your child's doctor about it, saying, hey, I know this might be a weird symptom. Sometimes we go in and we say things and we're like, oh, I don't want to be judged if they think that this is actually nothing and I'm making something out of it. But find a provider that you're really comfortable with and that you can just say those things to. Because oftentimes it's nothing. Every now and then there is something that we can really go with and be able to nip things in the bud.
Thank you so much. I appreciate you coming on here and sharing all of this with us. And I will have all of your information linked in the show notes for anyone that's wanting to reach out to you.
Perfect. Thank you for having me on. This was really fun. It's one of my favorite conversations to have.
Always a fun one, right? When it comes to talking about bowels.
Exactly.
Bowel.
It's an important picture of health right there.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.